talking about being that you're HIPAA compliant for medical specific related emails to patients. For us, that was one of the most important things for us as we were looking for a marketing partner that had HIPAA compliant emails. That alone, I think you'll start to see that other healthcare organizations will see the opportunity, especially being able to get in front of their patients. Easy enough, like being able to upload a spreadsheet and put Mr. or Mrs. and then their last name within the email is huge for us because you're personalizing it. And I think other healthcare companies and organizations would like to use it as well. But you got to remember, like we have millions. I have millions of patients I can upload, millions. We've only contracted for 1 million right now because we knew we wanted to see how it would work. But the fact is that if we're starting to see the return on just these ones that we're utilizing over the last 18 months, I mean, Dr. Simon initially wanted to, as soon as we sent out the first campaign, what did he say? He wanted to upload another 3 million. And I was like, hold tight, like let us work through some of this stuff, and then we'll go ahead and we'll work through it and add an additional contacts to that. So I think that as we see the changes, easily he's bought into it.
Yeah.
We're a national company and we need radiologists, and this is a different kind of setting, outpatient radiology versus hospital, where the radiologist has to be at the hospital. Ours can be working from home. But then it's like, how do we get in front of those individuals to let them know that we're hiring and that we're looking for them specifically, and what kind of options we have for outpatient radiology, to be able to figure out what those contacts are, and then to be able to get in front of them and actually give them insight into how our business works. And even just having a conversation with our radiologist recruiter to talk about the benefits of joining our practice. And they don't have to come on full time. You know, they can come on part time. But for us, it's huge. I mean, we're seeing record number of patients this year. I'm sure you guys know, like COVID was a real hit to healthcare in general. But for us, we're starting to see record numbers. A lot of women are coming back for their mammograms after missing them for the last 3 years. I mean, routine visits were cut off during COVID, and so we're now starting to see record numbers. Well, during that time, during COVID, obviously numbers went down, and unfortunately, we didn't need as many radiologists or as many team members to work. And so now that we're starting to see these record numbers, we have to staff up. We have to be able to get these people on board and help us read the images that are coming in from our patients. Our email that we're sending currently to our patients doesn't really have any HIPAA data in the email initially. Like, we do see that we may do that eventually, but right now we're not saying Mrs. So-and-so or Mr. So-and-so, just because initially we wanted it to be very generalized. Now, all of the content that we're uploading to your platform is HIPAA compliant, right? Because we're using, right, exactly. And we're using all the data based on, like, this month is Women's Health Month. So we wanted to make sure that we are touching certain people in certain areas where we have women's, like mammography and women's imaging, right? So obviously we're uploading that data and then we're utilizing it to pick and choose who we're sending those emails to. Once we get a chance, and just because we've only been using it, 3 months now, once we really dive in and really get a handle on exactly how we're using this, to have something that has their name, that they open, and we're giving them a clear picture of something specific for them, because it is marketing. We want to offer them something. We want a call to action. We want to maybe even call out something that they've done recently, like you were within our site getting a mammogram. We want to let you know that we'd like to see you, to come back in because of these reasons, or whatever that might be, or you have the opportunity, or this is what we're offering you next year when you come back, or something to that extent. Obviously, being able to then track that back to the appointments, and then tracking that ROI from that patient. I think the issue here, though, is also that obviously we have a per patient dollar amount based on the imaging that they receive. So that's how you're going to track back your ROI. But a lot of that is based on insurance too. So now you throw in your insurance, and you throw in your cash pay, right? And then you get that average. But it's different per state. So.